All right, picture this. It's your first day on the peds floor. You've got a 6-month-old, a 4-year-old, and a 15-year-old. How you talk to them, how you care for them, it's completely different for each one, right? Of course it is. And that's because understanding pediatric growth and development is the absolute foundation of everything we do in pediatrics. It's how we give care that's not just safe, but truly effective and compassionate. So let's dive in.
This right here is the million-dollar question for every pediatric nurse. It's not just about memorizing charts and stages. It's about becoming a skilled detective for a child's health. It's about knowing how to spot when a child is right on track, and just as importantly, recognizing when they might need a little extra support.
And this isn't just a nice idea or a suggestion. It's a core responsibility of our profession. We're not just ticking off boxes on a form. When we assess these milestones, we're watching this incredible, intricate dance of physical, cognitive, and social development. This is how we catch potential issues super early and tailor our care to what that one child needs in that one moment.
So here's our game plan. We're going to start with why this is all so critical. Then we'll take a journey through each stage of childhood, from the mind-blowing growth of infancy all the way to the search for identity in the teenage years. And we'll wrap it all up by focusing on your role as the assessor and the advocate.
Okay, so first things first, why does this matter so much? Well, it's because in peds, there's no such thing as a one-size-fits-all approach. Your entire plan of care, from how you explain a simple procedure to how you give medication, it all has to be developmentally appropriate. And it's so important to remember, your patient is never just the child. It's the entire family unit.
Our journey starts with the infant, from birth all the way to their first birthday. And let me tell you, this isn't just a year of getting bigger. It's a period of explosive, almost unbelievable change. The transformation from a totally dependent newborn into a little person who can walk and start to talk, it's the fastest period of development they will ever go through in their entire life.
I know, a chart like this can look like a lot at first glance, but let's just zoom in on the incredible speed of this change. At birth, it's all about simple reflexes like that involuntary grasp. Fast forward just a couple of months and boom, you get a social smile. By 9 months, they're communicating, dada, mama. And by 12 months, so many are taking those first wobbly, independent steps. It's just an incredible progression. And all that physical growth is happening right alongside some crucial psychosocial development. Erikson's theory really helps us get this. For an infant, the whole world boils down to one simple question. Can I trust this place? When their needs are met, when they're fed, comforted, and kept safe, they learn to trust. And that fundamental sense of trust, it's the foundation for every single relationship they will ever build.
So how does this all translate to your actual clinical assessment? You are on the front lines, the first line of defense in spotting developmental delays. This slide shows some key red flags that you've got to have locked into your brain. No attempt to lift their head, no response to a loud noise, not crawling by 12 months. These are not just little notes for the chart. They are critical signs that demand follow-up and could be the key to getting a child the early help they need.
So how do you put this into practice? Well, with infants, your communication is all about action. You build that trust by respecting their routines, right? You respond to their cries quickly. You use simple toys to engage them. And you have to remember, most of your verbal communication isn't with the baby, it's with their caregivers. They're your partners in this. Okay, so the infant has learned to trust the world. Now what? Now they're ready to explore it. Welcome to the toddler and preschooler years, what I like to call the age of independence. From ages 1 to 5, you're going to see a huge explosion in language, mobility, and that fierce desire to say, I can do it myself.
Erikson actually breaks this period into 2 key stages. For the toddler, it's autonomy versus shame and doubt. This is all about them wanting to gain control over their own bodies, and toilet training is the classic example here. When they succeed, it builds autonomy. Then, as a preschooler, they move on to initiative versus guilt, where they start trying to control their environment by making up games and leading play. This is where their sense of purpose begins.
Now, cognitively, Piaget tells us they're in the pre-operational stage. And the number one thing to remember here is that their world is completely me-centric. They literally cannot see things from someone else's point of view yet. And that's not them being selfish, it's just a normal developmental stage. Their thinking is magical, it's all about the here and now, and that's why our communication with them has to be so careful and precise.
This cognitive stage directly shapes how we talk to them. You've got to be concrete and super positive. Praise them, use stickers. Medical play with a doll before a procedure can work wonders. And your language is absolutely critical. They take everything literally. So you're not giving them a shot, which in their mind could be a gunshot. You're giving them a little poke to help them feel better. See the difference?
All right, we're moving on from the egocentric world of the preschooler to the ever-expanding universe of the school-age child. Now their world isn't just about family anymore. It's about school, friendships, sports teams, you name it. The focus really shifts from me to we as they work on mastering new skills and figuring out exactly where they fit in with their friends.
Erickson calls this stage industry versus inferiority. And really, they're constantly asking themselves, am I good at this? Getting an A on a test or making the soccer team builds that sense of industry, of competence. But if they're always struggling in school or feeling left out by friends, those feelings of inferiority can start to creep in. This is why a long stay in the hospital can be so tough for this age group. It pulls them away from the very place they build their confidence.
Cognitively, we see this huge leap into what Piaget calls the concrete operational stage. The key word to remember here is concrete. They can now think logically, but it has to be about real, tangible things they can actually see or touch. They finally get that if you pour water from a short, fat glass into a tall, thin one, it's still the same amount of water. This new logical power makes them way better problem solvers.
So, because they can think logically, your communication needs to empower them. You should treat them like partners in their own care. Let them choose which arm you use for a blood pressure cuff. Let them help you take off their own bandage. Encourage their questions, and trust me, they'll have a lot of them. And give them honest, simple answers. When you respect their intelligence, you build trust. It's that simple.
And finally, we get to adolescence. This is that really critical and often pretty turbulent bridge between being a kid and becoming an adult. If you had to boil this entire stage down to just one single theme, it would be the search for identity.
Erickson's framework just nails this with his stage identity versus role confusion. Teenagers are trying on all these different hats, right? Different friend groups, different hobbies, different beliefs. They're doing it all to figure out who they are, separate from their parents. When they succeed, they come out with a stable sense of self. If not, they can be left with a real confusion about their place in the world.
Their thinking abilities have also hit the final stage, what Piaget calls formal operational thought. And this is a total game changer. For the first time, they can think abstractly about ideas like justice or morality. They can think about hypothetical what-if scenarios. This is exactly why they can now understand the long-term consequences of health choices, something a younger child just isn't capable of grasping yet.
Now, talking with a teen might feel a lot like talking to an adult, but it is so crucial to remember their brains are still under construction. Use open-ended questions. Give them your undivided attention. And above all, respect their privacy. When a teenager asks for their parent to step out of the room for a minute, that is a sacred trust you have to honor. A lot of the time, your most important job is just to be a safe, non-judgmental ear.
Phew! So we've gone on this whole journey, from birthright to the edge of adulthood. So how do we actually pull all this information together into our daily nursing practice? Well, it all comes down to doing a truly holistic assessment, one that goes way, way beyond just taking a set of vitals. Here it is, your clinical toolkit boiled down to 4 essential actions. First, observe play. It's not just for fun. It's how kids show us what they know and what they can do. Second, apply theory. Use Erickson and Piaget as a mental roadmap to understand the why behind their behavior. Third, identify red flags. Be that vigilant detective we talked about and spot those delays early. And finally, communicate. Tailor every single word, every action to their specific developmental stage.
So, we've laid out the map of development, but every single child's journey along that map is going to be unique. The real art of pediatric nursing is using this knowledge not as some rigid checklist, but as a flexible guide to support, to advocate for, and to empower every single child and family you have the privilege to care for.